Welcome to Studious. Today, we are unlocking one of the most important structural frameworks in all of anatomy, the cardinal planes and axes of the human body. Think of this as the architectural blueprint that allows every medical professional, from surgeons to physiotherapists to radiologists, to describe the human body in three-dimensional space with absolute precision. This system is not just academic. It directly underpins how we describe surgical incisions, how CT and MRI scans are oriented, how physical therapists analyze joint movement, and how biomechanical research is conducted. The three cardinal planes, coronal, sagittal, and transverse, divide the body into distinct spatial sections. The three axes, horizontal, longitudinal, and sagittal, drive all joint movement. Master this system and you will have a complete spatial language for the human body. Let's build it from the ground up.
Before we can understand the planes and axes, we need to answer one essential question. Why do we need this system at all? The answer is clinical precision. The word cardinal itself means fundamental or of greatest importance, and that is exactly what these planes are. They provide a universally accepted spatial language of anatomy, ensuring precise communication across every medical discipline worldwide. Without a shared reference framework describing the location of a tumor, the orientation of a fracture, or the direction of a joint movement would be chaotic and error-prone. This is especially critical because patients are examined in all kinds of positions, lying on their back in a supine position, lying face down in the prone position, or standing upright. No matter how the patient is physically positioned during examination, the cardinal planes always refer back to the universal anatomical standard, preventing any clinical confusion.
The foundation of every plane and axis in anatomy is the standard anatomical position, described in this slide as the universal zero coordinate for all spatial references. Every directional term, every plane, and every axis is defined relative to this one baseline. Here is exactly what it looks like. The head and eyes are facing forward, looking straight ahead. The arms are resting neutrally at the sides. The hands are positioned with palms facing forward and thumbs pointing away from the body. This palm-forward orientation is critical as it determines dorsal ventral mapping of the hands. The feet are placed slightly apart, parallel to each other, with toes pointing forward. This position standardizes the human body in a way that transcends language, culture, and clinical setting. Whether you are in London, Lagos, or Lahore, anatomical position means the same thing to every trained medical professional.
Here is a conceptual distinction that many students miss entirely, and it is crucial. Planes and axes are not the same thing, and they serve fundamentally different purposes. Planes are two-dimensional. They are imaginary flat surfaces that slice through the body, dividing it into distinct spatial sections. Think of them like glass walls cutting through a three-dimensional figure. Axes, on the other hand, are one-dimensional. They are straight imaginary lines around which a biomechanical joint physically rotates. Think of an axis like the metal rod through the center of a wheel. The wheel, which is your body segment, spins around it. Planes describe and divide space. Axes generate and define movement. You cannot fully describe human motion without both. A movement always occurs in a plane and around a corresponding axis, and these two are always perpendicular to each other. This plane-axis pairing is the engine of biomechanics.
Let's meet the first of the three cardinal planes, the coronal plane, shown here in red. The coronal plane is a vertical plane that runs from side to side across the body, dividing it into an anterior portion, the front, and a posterior portion, the back. Its name comes directly from its anatomical reference point. It runs parallel to the coronal suture of the skull, the curved joint line that runs across the top of your head from ear to ear. When the coronal plane passes exactly through the body's center of mass, dividing it into perfectly equal front and back halves, it is specifically called the mid-coronal plane. Clinically, the coronal plane is essential in frontal view medical imaging, such as coronal MRI sequences and coronal CT reconstructions. It is also the plane in which lateral bending of the spine and abduction and adduction of the limbs are best visualized. Remember, coronal equals front-back division.
The second cardinal plane is the sagittal plane, shown here in blue. The sagittal plane is a vertical plane that runs from front to back, dividing the body into a left portion and a right portion. Its name derives from the sagittal suture of the skull, the bony joint that runs along the top of the skull from front to back, between the two parietal bones. When the sagittal plane passes exactly through the body's midline, from the tip of the nose to the base of the spine, dividing the body into perfectly equal left and right halves, it is specifically called the mid-sagittal plane, or the median plane. This is one of the most commonly referenced planes in clinical medicine. Movements occurring in the sagittal plane include flexion and extension, bending and straightening of joints like the knee, hip, and elbow. Sagittal MRI sequences are routinely used to evaluate the spine, brain, and knee. Remember, sagittal equals left-right division.
The third and final cardinal plane is the transverse plane, shown here in gold. Unlike the coronal and sagittal planes, which are both vertical, the transverse plane is perfectly horizontal. It runs parallel to the ground, dividing the body into a superior portion, the top, and an inferior portion, the bottom. It can be placed at any height along the body's vertical axis, at the level of the navel, the chest, the neck, or anywhere in between. The transverse plane has a critically important clinical application that you will encounter constantly. Sections taken through organs or tissues along this plane are universally known as cross-sections in diagnostic medicine. Every axial CT scan slice, the most common type of CT image, is oriented along the transverse plane. When a radiologist describes a finding on axial imaging, they are viewing the body through transverse plane slices. Remember, transverse equals top-bottom division and produces cross-sectional images.
Now that all three planes have been defined individually, this slide brings them together into the complete three-dimensional coordinate system of the human body. When the coronal plane, the sagittal plane, and the transverse plane are all placed simultaneously through the body's center, they intersect at a single point called the intersection node. This point is the anatomical equivalent of a three-dimensional origin coordinate in mathematics. Together, these three planes create a precise spatial grid that allows any structure anywhere inside the human body to be located with absolute specificity, no ambiguity, no vagueness. This is the system that makes modern medical imaging possible. A CT scanner generates hundreds of transverse slices. An MRI can reconstruct images in all three planes. A surgeon planning an approach uses this spatial framework to decide exactly where to cut, how deep to go, and what structures lie in each direction. Three planes, one precise grid, infinite clinical applications.
Now we shift from planes to axes, the lines around which the body moves. The first is the horizontal axis, also called the x-axis, and it runs from left to right across the body. This axis is formed at the intersection of the coronal plane and the transverse plane. To visualize it, imagine a rod running horizontally through a joint from one side of the body to the other. The classic example shown here is the elbow joint, a hinge joint. The humerus above and the radius and ulna below pivot around this horizontal axis. The resulting movements are flexion, bending the elbow, and extension, straightening it. These are the movements that occur in the sagittal plane, around the horizontal x-axis. This axis-plane pairing is the fundamental rule of biomechanics. Every movement occurs in a plane and around a perpendicular axis. The horizontal axis governs all hinge-type flexion and extension movements throughout the body, including the knee, the ankle, and the interphalangeal joints of the fingers.
The second axis is the longitudinal axis, also called the y-axis. This axis runs vertically, from the top of the head down to the feet, perpendicular to the ground. It is formed at the intersection of the coronal plane and the sagittal plane. To visualize it, imagine a vertical pole running straight down through the center of the body, from skull to feet, like the central axis of a spinning top. The primary example shown here is the atlantoaxial joint, the pivot joint between the atlas, C1, and the axis, C2, vertebrae at the top of the cervical spine. This is the joint that allows you to rotate your head left and right, the classic no movement. The resulting motions around the longitudinal y-axis are medial rotation, turning inward, and lateral rotation, turning outward. This axis governs all rotational movements in the body, including internal and external rotation of the shoulder and hip, and the rotation of the trunk.
The third axis is the sagittal axis, also called the z-axis, and it runs from the front of the body to the back, in the anterior to posterior direction. It is formed at the intersection of the sagittal plane and the transverse plane. To visualize it, imagine a horizontal rod running front to back through a joint, like a skewer going from your belly button to your spine. The example shown here is the carpometacarpal joint of the thumb, a saddle joint, one of the most mobile joints in the human hand. Rotation around the sagittal z-axis produces abduction, moving a limb away from the midline, and adduction, moving it back toward the midline. This axis also governs lateral flexion of the spine, bending sideways, and the opening and closing movements of the fingers. Understanding the z-axis and its associated abduction-adduction movements is essential for analyzing hand function, hip biomechanics, and spinal lateral bending in clinical practice.
This slide reveals one of the most elegant principles in all of musculoskeletal anatomy, the geometric origin of movement itself. Axes do not exist independently. Each axis is created precisely at the intersection line where two cardinal planes meet. This is the intersection mechanics principle, and it explains why planes and axes are inseparable concepts. The coronal plane intersecting with the transverse plane creates the horizontal x-axis, driving flexion and extension. The coronal plane intersecting with the sagittal plane creates the longitudinal y-axis, driving medial and lateral rotation. The sagittal plane intersecting with the transverse plane creates the sagittal z-axis, driving abduction and adduction. Every movement the human body makes is therefore the physical result of a geometric intersection between two cardinal planes. This is not just a theoretical concept, it is the biomechanical blueprint that physical therapists, orthopedic surgeons, and sports scientists use every day to analyze, diagnose, and treat movement disorders.
We close with the complete Cardinal Blueprint Matrix, your master reference cheat sheet for this entire topic. Let's read it together. The coronal plane divides the body into anterior and posterior sections, creates the horizontal x-axis at its intersection with the transverse plane, is best exemplified by the elbow's hinge joint, and governs flexion and extension movements. The sagittal plane divides the body into left and right sections, creates the longitudinal y-axis, is best exemplified by the atlantoaxial pivot joint of the neck, and governs medial and lateral rotation. The transverse plane divides the body into superior and inferior sections, creates the sagittal z-axis, is best exemplified by the thumb's carpometacarpal saddle joint, and governs abduction and adduction. 3 planes, 3 axes, 3 movement types, one complete biomechanical system. Save this matrix, study it, and you will navigate anatomy, biomechanics, and medical imaging with total confidence. Thank you for watching Med Studious. Like, subscribe, and share with every med student you know.